she was able to complete her season, and she was able to finish out strong. But the unfortunate thing is she had to go through 2 years of this pain and hurt and not knowing what was going on with her decline in her performance. So what I'm here today is to talk to you about how we can detect early on about iron and calcium deficiency. So let's get started. So what I'm going to do is talk to you a little bit about some questions of who, why, what, and how. So that's our theme, and as you can see, we have a bunch of question marks. Okay. So before we get started, we need to talk a little about terminology. So about iron, calcium, iron deficiency anemia, and calcium deficiency. So we're going to go through and define these. If you have any questions at any point, just raise your hand and I'll be more than happy to answer. Okay. So iron carries oxygen from our lungs throughout our bodies, and iron helps our muscles store and use oxygen. And that's very important when we're running. Iron deficiency is depleted iron stores in the body. So you just don't have any stored iron anymore. Okay, so iron deficiency anemia is when you have severe depletion of iron stores and low hemoglobin concentration. The hemoglobin synthesis is decreased in the red blood cells, and they are pale and small. These cells can't carry enough oxygen from the lungs to the tissues. So you can see how this could really impact your performance if you don't have that oxygen from your lungs. Okay, so now we're going to talk a little about calcium. So calcium is a mineral that provides bone structure and motion to our bodies. It is also stored in the bone, so it's readily available if our calcium level should get low. And then calcium deficiency is a low blood level of calcium known as hypocalcemia. Okay, so who is at risk? We have women in the reproductive years, ages 20 to 49. We have women have heavy, long, frequent menstrual periods. And people who are strict vegetarians or vegans. And then people who don't meet their daily energy requirements, meaning calories. And then endurance athletes, so people such as y'all. And you see a nice little picture of your team up there. Let's go to issue. Okay, so why? Why are these people at risk? Okay, the reason for iron is the repeated blood loss during menstruation. It's just that every month you're losing blood through your period. And then either it could be a lack of iron in their diet, especially for vegetarians and vegans. Sometimes they have a struggle with getting their iron in. People who have a low caloric intake, they're not meeting their calories. And then pain relievers that induce bleeding, such as ibuprofen and aspirin. And then we have people who have a high intake of iron inhibitors, such as fiber. Fiber is good, and it also inhibits iron. Okay, the loss of iron during sweat, feces, urine due to the stress of heavy training. So these are something like when you sweat, urine, and all that good stuff, you're losing iron at the exact same time. And then foot strike hemolysis. And this is where, when you're running, your feet are you're killing your hemoglobin. So your hemoglobin actually goes down, the red blood cells go down because of all the running that athletes tend to do. And so that's what foot strike hemolysis is you're actually decreasing your hemoglobin count. Okay, so why are these people calcium deficient? Okay, so weight conscious. So as runners, you want to be as lean and mean, and that's a really good thing. But there's a negative connotation with milk and calories. So a lot of people say, well, I don't want the calories, so I'm not going to drink the milk or eat the dairy products, such as cheese or yogurt and things like that. Okay, lack of vitamin D. Vitamin D helps absorb calcium. So if you're not out in the sun a lot, or if you're not consuming vitamin D in your diet, that can also hinder you. And then a failure to menstruate. When you have your periods, you have estrogen, and estrogen is really good for calcium. So when you're not menstruating, you're not producing the estrogen levels that you should be, and that actually has a decrease in your calcium. And then people who are lactose intolerant, they tend to stay away from dairy products as well. Okay, so what are the side effects of iron deficiency? So with iron deficiency, some of y'all might already know these. You have fatigue, weakness, headaches, poor resistance to cold temperatures, you're pale, you become iron deficiency anemia. That's like the worst case scenario. And then you have chronic degradation in performance, so you're not performing as well as you should be when you're iron deficient. Okay, so what are the side effects of calcium deficiency? Okay, you can have arthritis, high blood pressure, osteoporosis, and female athlete triad. And probably a lot of y'all know about the female athlete triad, and that is where you're not menstruating, you don't have a period for 3 months, you have low caloric consumption, you're not eating enough calories, and you are not, and that is due to your lack of period and the lack of calories, and that's what they call the female athlete triad. And then also the increase in your energy expenditure due to the workouts that you are having each and every day. Okay, so what are the side effects? So that was the iron, so that was some calcium, and now we're going to do some more calcium. So what are the side effects of calcium deficiency? So you might have leg cramps, irregular heartbeats, your nerves become extremely irritable, poor sleep disorder, and weakness in bones, which leads to stress factors and breaks. So I know you all have had some of those as well. And that's due to can be due to calcium deficiency. Okay, so we're going to do a little pop quiz. And do you know it? So we're going to match the pictures with the words. Let's just go over a few. So osteoporosis goes with what picture? A? No, C. Yes, C. Good. Yes, so that's what your bones, so this is the good side. This is what normal looks like. This is what we want your bones to look like. And this is when you have osteoporosis. Now, osteoporosis you will not see until probably later in your life. I mean, some as young you might have, but it probably won't be until like your 40s. But what you're doing now, due to the lack of calcium, can affect that. Okay, so female athlete triad. B. Yeah, B. Yeah, she's very weight conscious, kind of sad. So yeah, she's very skinny. Okay, arthritis. D. Okay. D. Very good. So yeah, so arthritis is when it's in the joints. That's what you will have arthritis. So either in your shoulders or in your knees. So wherever there's joints, you can have arthritis, and then stress factors. Okay. Yes. Last one. Good job. And that's just a tear in the bone. Okay. So how? So we've gone through the who's at risk, what, and the why. So how can we detect iron deficiency? And these are some tests. I know y'all get tested in your season for iron. And these are some tests that, if you ever look at your lab values, or whenever, I don't know if you get to see your blood test, but these are some of the tests that do happen. So we have hemocritic, and this measures the proportion of red blood cells in the blood plasma. And it needs to be between, the normal values is between 36 to 44%. Hemoglobin, which is blood, is the iron-containing protein in red blood cells. And we like to see that in between 12 to 15.1. And then ferritin. Ferritin is really the blood test that they see about your storage of iron. And this needs to per deciliter. Ionized calcium test checks the amount of calcium that is not attached to the protein in the blood, and that needs to be between 4.65 to 5. Okay, milligrams per deciliter. And then bone mineral density test. This checks the amount of calcium in the bones, and this is a really good test, but this test is done by DEXA, and it's a really expensive test, so most of the time it's not prescribed or you don't get it unless they see that you really might be at risk. And this is a good test. The bone mineral density test is a good test to do to see if you are at risk for osteoporosis. And these are for it's a very expensive test, and these are for kind of for more severe patients. Okay. So what I would like you all to take away from today's lesson is to be aware that you are at risk. Now you have the knowledge to help not only yourself, but your teammates as well. So if you see any of the signs or symptoms, or when you get your test done, and you look at the levels and you see that they're low, you know that that's due to iron calcium deficiency. And if you want to be at your peak performance, remember to guard against iron and calcium deficiency. So with all that said, we're going to have another session, and they're going to talk about how we can improve our iron and calcium stores. And before